Welcome to Rwanda Medical Academy. Today's lesson is about understanding substances that cause hyperthermia, and we will use the NASA Mnemonic to help you remember. Introduction. Explore the NASA Mnemonic for understanding substances causing hyperthermia. This lesson delves into various substances, their mechanisms, clinical manifestations, and management strategies associated with hyperthermia. From Neuroleptic Malignant Syndrome, NMS, to nicotine, antihistamines, alcohol withdrawal, salicylates, sympathomimetics, serotonin syndrome, Anticholinergics, antidepressants, and antipsychotics, grasp the intricate details to effectively recognize and manage hyperthermia-inducing conditions. Part 1. Neuroleptic Malignant Syndrome, NMS, and nicotine. A. Neuroleptic Malignant Syndrome, NMS. NMS is a rare but life-threatening reaction to antipsychotic medications, characterized by hyperthermia, altered mental status, and autonomic dysfunction. Pathophysiology involves dysregulation of dopamine receptors, leading to hyperthermia, muscle rigidity, and autonomic instability. Clinical manifestations include hyperthermia greater than 38 degrees Celsius, severe muscle rigidity, altered mental status, and autonomic dysfunction. Management: immediate discontinuation of the offending antipsychotic, aggressive cooling measures, supportive care, and sometimes pharmacological interventions. B. Nicotine. Role in hyperthermia. Nicotine stimulates the release of catecholamines, leading to vasoconstriction and increased metabolic rate, resulting in elevated body temperature. Mechanism: activation of nicotinic receptors in the central nervous system and peripheral tissues triggers sympathetic activation, leading to increased heat production. Clinical implications: nicotine-induced hyperthermia can present as tachycardia, diaphoresis, and elevated body temperature. Interventions: smoking cessation interventions, supportive care, and monitoring for signs of hyperthermia in nicotine users. Part 2. Antihistamines and alcohol withdrawal. A. Antihistamines. Mechanism: blockade of histamine receptors can impair central thermoregulation, leading to hyperthermia. Clinical considerations: antihistamine-induced hyperthermia can occur due to overdoses or interactions with other medications. Management: supportive care, monitoring for signs of hyperthermia, and consideration of antidotal therapy in severe cases. B. Alcohol withdrawal. Pathophysiology. Abrupt cessation of alcohol intake can lead to hyperactivity of the sympathetic nervous system, resulting in hyperthermia. Clinical features: hyperthermia, diaphoresis, tremors, agitation, and hallucinations are common manifestations of alcohol withdrawal. Treatment: symptom management, supportive care, and consideration of benzodiazepines for symptom control and prevention of complications. Part 3. Salicylates, Sympathomimetics, and Serotonin syndrome. A. Salicylates. Toxicity: salicylate overdose can lead to impaired oxidative phosphorylation, resulting in hyperthermia, metabolic acidosis, and multi-organ dysfunction. Presentation: hyperthermia, tachypnea, metabolic acidosis, and altered mental status are hallmark features of severe salicylate toxicity. Management: supportive care, gastric decontamination, correction of acid-base abnormalities, and consideration of hemodialysis in severe cases. B. Sympathomimetics. Mechanism: activation of adrenergic receptors leads to increased metabolic rate, vasoconstriction, and hyperthermia. Examples: drugs like amphetamines, cocaine, and ecstasy can induce hyperthermia through sympathomimetic effects. C. Serotonin syndrome. Serotonin syndrome induces hyperthermia through its effects on the central nervous system. Excessive serotonin activity leads to increased muscular activity, which generates heat and raises body temperature. Additionally, serotonin affects the hypothalamus, a brain region involved in temperature regulation, causing dysregulation and elevation of body temperature. Severe cases of serotonin syndrome can result in profound hyperthermia, exceeding 41.1 degrees Celsius, due to a combination of increased metabolic activity and disrupted thermoregulation. Treatment: supportive care, aggressive cooling measures, and consideration of benzodiazepines for sedation and muscle relaxation. Part 4. Anticholinergics, Antidepressants, and Antipsychotics. A. Anticholinergics. Disruption of thermoregulation. Anticholinergic medications inhibit sweating and impair heat dissipation, leading to hyperthermia. Examples: drugs like atropine, benztropine, and antihistamines possess anticholinergic properties and can induce hyperthermia. Management: supportive care, cooling measures, and consideration of physostigmine as an antidote in severe cases. B. Antidepressants. Hyperthermic effects. Some antidepressants, particularly serotonin reuptake inhibitors, can lead to serotonin syndrome, characterized by hyperthermia, neuromuscular hyperactivity, and autonomic instability. Clinical presentation. Hyperthermia, agitation, tremors, and altered mental status are common features of antidepressant-induced serotonin syndrome. Treatment: supportive care, cessation of the offending medication, and sometimes serotonin receptor antagonists in severe cases. C. Antipsychotics. Risk of hyperthermia. Certain antipsychotic medications, particularly first-generation agents, can lead to NMS, a severe form of hyperthermia. Examples of certain antipsychotic medications, particularly first-generation agents, that can lead to Neuroleptic Malignant Syndrome, NMS, include haloperidol, chlorpromazine, flufenazine, trifluoperazine, thioridazine. These first-generation antipsychotics have been associated with an increased risk of NMS, a severe and potentially life-threatening condition characterized by hyperthermia, altered mental status, muscle rigidity, and autonomic dysfunction. Prevention: careful monitoring of patients on antipsychotic therapy, awareness of risk factors for NMS, and prompt recognition of symptoms. Management: immediate discontinuation of the offending medication, aggressive cooling measures, and supportive care to prevent complications. Conclusion: understanding the diverse array of substances that can induce hyperthermia is crucial for medical professionals to promptly recognize and effectively manage these potentially life-threatening conditions. Through comprehensive knowledge and vigilant monitoring, healthcare providers can mitigate the risks associated with substance-induced hyperthermia and optimize patient outcomes. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.